Coronavirus has spread across the globe, with second waves and lockdowns implemented to stem the spread of the virus. In December, England exited its second lockdown, dubbed Lockdown 2.0, with cases continuing to spike in recent months. Now a tiered system is in place across the country, with bolstered rules in a bid to bring down the R rate. However, swathes of the country have entered Tier 4, effectively lockdown conditions once more. COVID-19 is spread through droplets in the air which are exhaled when an infected person coughs, sneezes or talks. These droplets can then land on surfaces or directly on people, and if a person touches their face after picking up these droplets, they can then enter the body through the mouth, nose and even eyes. As coronavirus is a new virus, scientists have been urgently working to understand how it spreads, and how to vaccinate against it. Now pharmaceutical giant Pfizer and its vaccine partner BioNTech have launched a vaccine, with Britain's the first to receive it. Now a second vaccine has been approved in the UK, giving hope to the end of lockdown restrictions. Groups of people, starting with the over 80s and healthcare workers, are first in line for the groundbreaking jab. With coronavirus continuing to spread while the vaccine is being issued, mask wearing, hand washing and social distancing are the top ways the government has advised Britons to avoid catching or spreading the disease. Symptoms of COVID-19 have been described as flu-like, but what are the early symptoms? Symptoms of coronavirus vary from person to person and can be more severe in some people. Generally, common symptoms have been described as being flu-like, with fever, cough, and shortness of breath. However, the Centers for Disease Control, CDC, has updated its official list of symptoms to include chills, repeated shaking with chills, headache, sore throat, muscle pain and new loss of taste or smell. The organization also amended the shortness of breath symptom to shortness of breath or difficulty breathing. This means the CDC's full symptom list for COVID-19 is the CDC explained any of the 9 symptoms may manifest anywhere from 2 to 14 days after exposure to the virus. The World Health Organization, WHO, says the most common symptoms of COVID-19 are fever, dry cough, and tiredness. WHO's website states, some patients may have aches and pains, nasal congestion, sore throat or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but only have very mild symptoms. If you are suffering from mild symptoms of coronavirus, the NHS advises you stay home and do the following: only use the NHS 111 online coronavirus service if can you get coronavirus but have no symptoms. One concern has been the fact some people can be carriers of the virus, without themselves experiencing symptoms. This is known as being asymptomatic, when the virus does not cause symptoms but can still spread to others. Sir Patrick Vallance, the UK's chief scientific advisor, said, "It looks quite likely that there is some degree of asymptomatic transmission. There's definitely quite a lot of transmission very early in the disease when there are very mild symptoms.